Hi, everyone. Hello, hello. How are you guys doing today? So excited to be back on our next live airing of Dr. Sumner's Summit to Wellness. I wanted to come on today and talk with you guys about a topic that is very important. A recent celebrity, Luke Perry from Beverly Hills 90210, died from a massive stroke at the age of 52. So young. Stroke is the third leading cause of death for women and fifth for men. And unfortunately, the statistics are even worse for African Americans, who are twice as likely to have a stroke and twice as likely to die from one. Hi there, Gretmet. Thanks for joining. Thanks for joining, Mawal. The craziest part about this, though, is that 80% of strokes are actually preventable, according to the CDC. And with just some very important but doable lifestyle changes, you can practically avoid being a statistic. Hi, Daia. Thanks for joining. So I wanted to share some of these things with you today. And just a reminder that I am Dr. Felicia Sumner. I'm your board-certified family medicine physician and wellness strategist, and I am dedicated to empowering you and your communities to become well, whole, energized, and loving life. And I currently do this through speaking engagements, telemedicine services, and online coaching services. So if you're watching, please comment and say hello, or if you're catching the replay, type in #replay. I'd love to know if you're here. I also need to just remind you briefly of a disclaimer that as much as I truly enjoy helping you by informing you on topics related to your health and wellness, this is not medical advice. This is for informational purposes only. So if you have any specific questions related to your individual diagnosis or treatment plan, then please discuss them with your doctor. And if I'm not your doctor and you'd like me to be, then please message me or click my Book Me link on Facebook or my website, and I'd be happy to get you set up for an appointment. All right, I currently see patients in the states of Georgia and Pennsylvania online, and it would be my pleasure to see you. Okay, so now that all of the lovely intros and disclaimers and all that fun stuff are out of the way, let's chat about this. Did you know that most strokes typically occur without any warning at all? That's why I think prevention is so important. Stroke can be one of those silent killers, and once you suffer a stroke, the damage can sometimes be devastating. The most common type of stroke is what we call an ischemic stroke. Hi, Colin, thanks for joining, which I think is best simply to explain as a brain attack, very similar to a heart attack. The only difference is that the blood clot blocks blood flow to your brain instead of to your heart. So as a result, your brain cells, they begin to die. And naturally, the longer your brain goes without oxygen, the greater your risk of lasting brain damage. And this is an area where conventional or traditional emergency medicine excels, as there are medications, emergency medications that can actually dissolve that blood clot that is blocking blood flow to your brain. And if it's done quickly enough, it can basically reverse any permanent neurological damage. That's why it's so important to get emergency help right away when you or a loved one are concerned that you're witnessing signs of a stroke. The goal is to get emergency help within the hour. And if it's past 3 hours, there's often very little that can be done to reverse the damage that a stroke may cause. So to recap on that, FASTER, F-A-S-T-E-R, are the signs to look out for. And if you'd like more info on that, then please check out the last video that I have posted. Clearly, in the cases of strokes, and most diseases, prevention and your diet plays a huge role. So let's talk about five different foods that you need to avoid if you want to significantly decrease your risk of stroke. Because as I've said before, what you don't eat is often more important than what you do eat. So number one, trans fats. Have you guys heard of that before? Trans fats? Avoid it. Don't pass go. Stay far away from it if you're really concerned about anything when it comes to your health in general. Anything with trans fats are huge culprits for building inflammation and many times lead to chronic diseases like stroke. These usually include a bunch of different processed foods like crackers, chips, most store-bought baked foods, baked goods, and any fried foods, just to name a few. Especially for women who have reached menopause, eating a diet high in trans fats leads to a 30% higher chance of having an ischemic stroke, a stroke where the blood supply is cut off by a clot. Keep in mind that saturated fats, guys, are not the same as trans fats. There are many healthy saturated fats, so don't lump them into the same category. So one to avoid to decrease your risk of stroke significantly are trans fats. Number 2, smoked and processed meats. There are certain preservatives like what we call sodium nitrate and sodium nitrite found in smoked and processed meats that have been shown to significantly damage your blood vessels, which could increase your risk of stroke. These include hot dogs, yeah, I said it, hot dogs, bacon, salami, and other processed meats. These types of meats could increase your risk of diabetes by 50%. They could even lower your lung function and increase your risk of chronic obstructive pulmonary disease, also known as COPD, just so you know. I'd recommend that you keep these foods to a minimum, and if you are going to eat bacon or sausage or ham or any other processed meat product once in a while, they have to be organic meats that are grass-fed or free range. You should look for what's called uncured varieties, UNCURED, that contain no nitrate. They should have 100% beef or 100% chicken, etc. And this is the only way to know that the meat is from a single species, and it doesn't include byproducts like chicken skin or chicken fat. So you should also avoid any processed meat that contains MSG, high fructose corn syrup, preservatives. It might say artificial flavors or artificial colors. Those can also increase your risk of stroke significantly. So often the best way to help guarantee that these types of meats like bacon, sausage, ham, etc. are okay is to purchase them from a small local organic farmer who you can ask about the ingredients, okay? So that's number 2. Food number 3, oh, this one is a biggie, is diet soda. I said it, guys, diet soda. A lot of people I know swap out the Sprite, the Coke, or some other soda for a diet version, but I'm on my soapbox so often about how this really is just a marketing ploy and has no great effect on your health. There was a huge recent study showing that people who drink just one diet soda a day may increase their risk of stroke by 48%. One diet soda a day can increase your risk of stroke by 48%. Not only that, but diet soda can also increase your risk of heart attacks too. There's a number of studies out there beginning to prove that artificial sweeteners like aspartame and sucralose, aka Splenda, they can actually be quite dangerous to your health, especially aspartame. There's reports of adverse reactions to the US FDA. They also support this because aspartame accounts for over 75% of the adverse reactions that are reported by food additives to the FDA. So look on your ingredients list, and if you have a sugar-free beverage, a sugar-free food, or even sugar-free gum, aspartame is likely to be on the list. And I've seen it be a common cause of headaches, and some studies are even linking it to brain cancer, let alone stroke. So stay far away from those sugar-free additives, especially aspartame and sucralose, also known as Splenda, they can increase your risk of stroke. Food number 4 is red meat. The thing is that not all red meat is dangerous, okay? But you have to be very specific about the type of red meats you consume. There's a big difference between what's called CAFO, confined animal feeding operations meat, and organically raised grass-fed meat. Organic grass-fed beef is typically not associated with any of the ill health effects that you see from CAFO beef. But very few researchers, unfortunately, let alone journalists, ever make this distinction. So if you're going to eat red meat, be sure that it is organic, free-range, grass-fed beef. It makes a huge, huge difference, okay? Hi, Annette. Thanks so much for joining. Thanks for joining, Brittany. Thanks for joining, Simone. Glad to have you here. Number 5 food is salt. As for salt, you cannot compare the processed salt with natural unrefined salt, okay? Processed salt is really the culprit in most cases when it comes to stroke and even heart disease and high blood pressure for a lot of people. So if you're going to ingest salt, if you're going to ever add salt to your cooking, make sure it's unrefined sea salt or Himalayan salt, not the regular processed table salt. It makes a huge difference, okay? So we've talked about 5 types of foods to be cautious about when it comes to preventing stroke, which is 80% preventable with lifestyle changes. We talked about staying away from trans fats and diet sodas. We talked about being very cautious about the types of processed meats, red meats, and salts you eat. These 5 things can make a huge difference in decreasing your risk of stroke. Now, I'd also like to share with you guys a very important vitamin that can play a huge role in your risk of having a stroke. What vitamin do you think I'm talking about? This is the only vitamin that has multiple gene regulation functions in your body. And low levels of this vitamin, if you're deficient in this vitamin, it can potentially double your risk of stroke, if not more. Okay, what vitamin do you think I am talking about? I'm talking about vitamin D. Yes, as you probably know, if you followed me long enough, I'm a huge, huge advocate of vitamin D. If your levels are low, and I consider low to be less than 60, which the conventional labs may not use these values, then please talk with your doctor about getting supplementation. Or if you hadn't had your levels checked as of yet, please do so ASAP. Vitamin D can not only decrease your risk of stroke, but also of heart disease, infections, depression, bone disease, certain cancers, and the list goes on and on and on. Okay, so a few other things aside from vitamin D and the foods I just shared with you that I think are worth mentioning are smoking. If you're a smoker, please seek help to stop smoking ASAP. If you smoke 20 cigarettes, that's about a pack a day, you have 6 times more risk of having a stroke than a non-smoker. Aside from stroke, as you may well know, smoking greatly increases your risk of heart attack, high blood pressure, diabetes, lung cancer, lung disease, other cancers, and the list goes on and on. So if you need help to quit smoking, please, please, please message me, and I'd be happy to help you get set up with the right resources, please. Another thing worth mentioning when it comes to decreasing your risk of stroke are certain medications, especially hormone replacement therapy and birth control pills. If you're on one of the hormonal birth control methods, whether it's the pill, the patch, vaginal ring, or an implant, it is important to understand that you are taking synthetic progesterone and synthetic estrogen, and something that is clearly not advantageous if you want to maintain optimal health. Because these birth control methods, they contain the same synthetic hormones that are used in hormone replacement therapy, which has well-documented risk, like an increased risk of blood clots, increased risk of stroke, of heart attack, and breast cancer. So please, please discuss with your doctor so you can be aware of these risks and potentially change your birth control method if you are concerned about your risk of stroke especially. Okay, now, God forbid, if you or a loved one has especially recently suffered from a stroke, I wanted to mention 2 natural treatment methods that studies are now showing could make a major, major difference in improvement of your neurological function immediately after a stroke. One is vitamin B3, also known as niacin. Studies in mice with ischemic stroke, which is the stroke where the blood supply is cut off, showed that when they were given niacin or vitamin B3, their brains showed growth of new blood vessels and sprouting of nerve cells, which greatly improved their neurologic outcome. So this clearly needs to be studied, of course, more in humans, but at the very least, it's a clear example of how nutrition is at the heart of many healing mechanisms in our body, even when it comes to something as serious as a stroke. But the irrefutable treatment of choice for acute stroke rehab, so once you have a stroke, to be able to reverse the effects of the stroke immediately after, would be what's called hyperbaric oxygen therapy, also known as HBOT. Have any of you heard of that before, hyperbaric oxygen therapy? I think they showed it on an episode of Grey's Anatomy or something, but research has shown that HBOT, hyperbaric oxygen therapy, helps your body produce and mobilize, or help basically get them going, mesenchymal stem cells, which are the beginning cells of brain and neurocells, which play a major role in your body's attempt to repair any injured tissues or cells, including in your brain. In my recent experience, I've seen amazing results from patients who have tried HBOT, hyperbaric oxygen therapy, immediately after a stroke, a coma, or even in situations when someone's considered brain dead after cardiac arrest. So if your loved one suffers from a stroke, it is something to immediately bring up to their doctor while you're in the ER or the hospital about the potential for treatment with this modality, because not every hospital has that ability, and the sooner that person gets that kind of treatment, the better their chances of recovery from any deficiencies the stroke may cause. It could literally save their lives. All right? So let me just recap here. We talked about 5 different types of foods that could play a major role in decreasing your risk of stroke, which is 80% preventable. 1 was trans fats. 2 was diet sodas. 3 was processed meats like sausage, ham, bacon, to be very cautious about the type of processed meats you're eating, okay? Without nitrites, nitrates, that they should be organic. Number 4 was red meats. It's okay to eat red meats, but again, you have to be careful about the type of red meats you're eating. They need to be organic, non-CAFO meat, grass-fed, free-range meats. And number 5 was, what was number 5? Can you remind me? We talked about number 5 was, I'm having a blank here. We talked about number 5 was, salt. Okay. And salt. We have to be careful about the type of salt we're eating, that they need to be non-refined, non-processed salt like sea salt or Himalayan salt. Okay. So I hope that was helpful for you. We also chatted about smoking. If you're a smoker, especially if you smoke more than a pack a day, your risk of having a stroke is 6 times greater than a non-smoker, okay? And we also chatted about the medications that you're taking could increase your risk of stroke, especially birth control pills, for example. Okay, so let me know if that was helpful for you. Please comment below. Let me know what you think. Did you learn anything new? I hope so. If you have any questions, feel free to ask me. I'll hang around for a few more seconds or minutes to answer them. But if you think that this was helpful, please share. And just a reminder that if you are a resident in the state of Georgia or Pennsylvania, I am offering a free, hear me, free FREE one-on-one discovery session for you to find out if I could be the right fit for you. I offer a number of different packages as a primary care physician, or just a root cause physician detective or a functional medicine consultant if you'd like to keep your current primary doctor and just have a wellness strategy session with me to dig deeper about what's causing your concerns. I'd love to chat with you and have a free discovery session with you to find out if I'm the right fit. And it is free for now, but not for always. So don't miss out on this offer. Just hit my Book Me page if you're interested. Or go to drfsumner.com. So if there are no further questions or comments, I will see you guys next time. I hope it was helpful. Please share if it was. And until then, please be well, whole, energized, and loving life. Take care, guys. Bye-bye now.